Welcome back, guys. It's Dr. Mike, physical therapist. Today we're going to be talking about how to improve ankle mobility. Now, most specifically, we are talking about ankle dorsiflexion. This is your ability to flex your ankle up, and we need approximately anywhere between 10 to 20 degrees just for functional use. So today I wanted to show you a quick technique that you can use to help improve ankle dorsiflexion. Now, we're going to use a box, or you can use a chair at home or a step stool. And we're going to focus on releasing some of the tissue behind the calf. Now, when we're thinking about the calf muscle, we have two muscles that we're dealing with. We have the first muscle, which is the gastrocnemius, which is the muscle that basically crosses the knee joint. We got a large muscle belly here that attaches to the Achilles tendon and wraps around underneath the foot. And then we also have the soleus muscle, which that muscle in particular will help show us how much dorsiflexion we have when our knee is bent. So we're going to focus on using a myofascial release technique that we can use. We're going to use our fingertips on both sides, and notice that I'm on the back end of the leg here, and I'm going to apply a little bit of pressure and find and locate the outside of that soleus muscle there. And most importantly, one of the biggest mistakes people make on this stretch or any type of calf stretch is that when they're stretching, they're not really paying attention to what's going on at the knee. So you'll often see the knee kind of cave in and they're kind of feeling like, oh, I'm not really feeling a good stretch. But we want to make sure that we track that knee right over the second and third toe there. So I'm going to apply my fingers right in the behind the calf there, apply some pressure, kind of like I'm pushing inward into my leg, and then I'm gonna work through some, we call this functional mobilization. So I'm mobilizing the connective tissue, the fascia, the muscle, trying to release any tension or tightness in that area. I'm moving the knee forward and back, going to where I feel that tension behind the calf. And then I can even start to work my fingers all the way down. I don't necessarily need any lotion with this or anything. You might be able to have a good tack right on the skin, and you'll feel some very sensitive areas. So you'll realize after just 1 or 2 minutes of working on this, that ankle is going to feel more flexible. The knee is going to be able to track forward, and things like squatting or bending over and utilizing those functional tasks are going to be a lot easier after a simple technique that you can do at home on yourself. Now, if you want to learn more about how to improve your foot health, check out the video I made up here. In the meantime, if you enjoyed this video, please give this video a thumbs up, comment below on any topics you'd like for me to cover, and subscribe to the channel to stay up to date with all upcoming videos. I'll see you in the next one.